Welcome to Emend Healthcare. As part of our clinical team, your mission is to safely guide residents through the process of taking their own medication. The absolute rule of our facility is that staff observe. You do not directly administer doses. You act as the final checkpoint. Your job is to verify that the right person takes the correct pill without ever physically placing that medication into their mouth. Executing this strict, hands-off procedure eliminates medication errors, prevents drug diversion, and proves you are ready to work the floor. The process begins with the right environment. Set up in a private, distraction-free room where only you and the self-administering resident are present. We follow a strict one-bin rule. Pull exactly one resident's bin from the double-locked cabinet and keep it strictly on your side of the desk. Never pull two bins at once. Ask the resident to state their full name and date of birth. Verify this against the medical record. Room numbers are never used as identifiers. Before handing over any container, run through the 6 rights: resident, medication, time, dose, route, and documentation. Confirming right time means checking the order against our daily dosing windows: AM, noon, evening, or bedtime. Doses outside these windows require nurse approval. Rushing this setup or skipping a verification step causes wrong patient and wrong dose errors. Take the time to clear every check. Hand the resident exactly one medication container at a time. Never give them the entire medication bin. The resident must read the label aloud. Have them state the medication name, the reason they are taking it, and the total pill count they are placing in their tray. Maintain unbroken visual contact as the resident takes the pills with a cup of water. Stay focused on their hands and mouth. Require a physical mouth check. Instruct the resident to drink water, swish it thoroughly, and open wide so you can confirm their mouth is empty. Executing this mouth check on every single dose, even for residents you trust completely, stops medication hoarding and diversion. Have the resident sign the electronic pad immediately. Once they sign, add your own digital signature to the medication observation record. Documenting at the end of your shift is strictly prohibited. You must log the dose at the exact time of observation. As soon as the digital signatures are captured, return the medication bin directly to the double-locked cabinet. Real-time documentation creates an accurate medical record that protects the facility during compliance audits. If a controlled substance falls on the floor, it is contaminated. Stop the resident from picking it up. That pill cannot be administered. A dropped controlled medication triggers our waste protocol. 2 authorized staff members must witness its destruction, sign the waste log together, and get a nurse's approval before pulling a replacement dose. Pay close attention to look-alike and sound-alike medications. Slow down and verify the spelling on the label against the medical record, character by character. Monitor for side effects like tardive dyskinesia in residents taking neuroleptics. Watch for involuntary movements like rapid eye blinking or fingers playing an invisible piano. If you spot these sudden grimaces or involuntary movements, halt the observation and alert a healthcare practitioner immediately. If a medication error occurs, secure the resident's safety first. Call 911 in an emergency, notify the prescribing physician, and submit an honest incident report. Both reported errors and intercepted near misses provide safety intelligence that helps us fix systemic issues. Here is the flowchart for a perfect cycle. Pull a single bin, check 2 identifiers, verify the 6 rights, hand over 1 container, perform a mouth check, and document immediately. Through every step, your role remains strictly defined. You observe and verify. You never administer. Before you can supervise doses on your own, you will complete an on-site practicum with a qualified professional to prove your competency. Executing this routine for every dose actively protects resident recovery. Thank you for keeping our residents safe at Emend Healthcare.